Well, for the very first time, Ohio is reporting more than 5,000 daily COVID-19 cases, once again breaking the record. The state also broke its record for hospitalizations, with 231 reported in a 24-hour period. As cases in Ohio continue to surge, there is a growing fear at hospitals that, it's not about the lack of supplies, but it's the potential lack of staff members there. Reporter Raven Richard explains more.
A community spread of COVID-19,
which can and has resulted in increased patients in the hospital, also has an impact on the staff.
Dr. Steve Feagins, medical director for Hamilton County Public Health and the chief clinical officer for Mercy Health, explains.
It's individuals walking around without masks. It's individuals who are being part of small groups or even larger groups that are not social distancing,
who then come in contact with a hospital worker outside the hospital, forcing that staff member to quarantine. That staff is essential for patients recovering from COVID-19. Patients like Tammy Potts' dad, Gary Campbell, who our Kristen Hartman reported on earlier in the pandemic.
We know that he had the best care team taking care of him, doctors, nurses, therapists, chaplains.
Campbell is now back healthy. For Potts and her dad, lack of staff was not a concern. But as cases continue to bubble and reach the medical community.
A doctor, instead of taking care of 2 patients, has now got 20 or whatever. The numbers are much higher because the other doctor he works with or she works with is out sick or potentially sick.
At any given time, about 5% of hospital staff are out. But because of COVID, Dr. Feagins says that number is now a couple of percentages higher. And Dr. Feagins says the concern is not only for the medical staff inside of hospitals, but for first responders, 911 operators, and EMS. His message, again, is simply mask up, not only for yourselves, but for the medical community. In Cincinnati, Raven Richard, WCPL 9 News.